I would say that a very general estimate, right? 9 out of 10 children that come here will confirm cry one.
Very good.
So working in a pediatric hospital, right, the biggest challenge should be trying to elevate the fears of the patients, mainly the children, because it's not as easy as adults. Because children, some of them are not verbal, so they won't be able to voice their pains or their fear. So it is up to us to see from their body language and to help them as best as we can. We will usually play songs or videos just for the younger kids. We also ask the parents to stay with them so that they can help ease the child's fear.
The KK Women's and Children's Hospital's Children's Emergency. This is Singapore's first and largest dedicated 24-hour acute care facility for babies and children aged 0 to 16 years. It manages about 400 patients daily.
The very unique feature that makes us different from other emergency department is that when our patients first come in, the first touch point is always a nurse, a medically trained person, rather than when they first come in, they go and register patient first. Because children, they are actually a very vulnerable group. We can't afford to let the child sit there and wait for registration and whizzing away. Let's say their condition is life-threatening, we will attend to them immediately, even without doing all the administrative work.
So this is a 3-year-old boy who sustained a laceration while at home. Mom brought him here, and on assessment, he had a gaping laceration over his forehead. He subsequently underwent suturing as well as dressing of the wound in the children's emergency. Besides the head, did he complain anywhere else pain? I think this one become like... You pain or no? 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 Okay, don't be scared. You just tell us pain or not. You only notice it now, is it? At home just now wasn't like that. Okay, take picture, then we put magic cream.
So what sets us apart is we are a pediatric hospital. I am aware and I'm sure that my colleagues in the other adult hospitals are able to handle children as well. But on our side, most of our colleagues here, the nurses, the doctors, we are all in a way trained or experienced in handling children. Okay, handling what we mean is being able to speak to them. So we won't use technical jargons to speak to them. We try to speak at their level so that they can understand us and hopefully help us with the procedures.
That's Cocomelon, Mama. Cocomelon, okay? Cocomelon. He actually like cars, more on cars. 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 Kiss mommy. Kiss mommy. Love you, okay? I don't know when's the street. Why is it? Cold, okay? So we cover you.
Okay, good job. Good job.
The emergency department is also the main facility leading the response for pediatric COVID-19 cases in Singapore.
I've been working in CE for 16 years already. There are different challenges from high patient loads, long waiting time. But I think recently, because of this pandemic, the biggest challenge will be how we cope with this situation. There's a lot of uncertainties. So a lot of changes to like workflows, guidelines. It's about how we tweak our workflows so that our staff don't get like burnout or how we distribute our manpower evenly so that we don't overload each area. Initially, the tentage was built to house all these patients with respiratory symptoms. But once the tentage is up and we realized that actually about like 80% of our patients are all squeezed into the tentage, which is very overwhelming for our staff. So we had to make this very quick and drastic decision to actually flip the workflow around. where we bring the patients with respiratory symptoms back into the main CE. Later on, during like the Omicron surge, because the patient load gets increasingly higher and higher, so we had to quickly set up like our decon area to house all this overflow of patients. But even so, after that, actually even the decon area cannot hold the patients there efficiently. So we had to again flip our patient flow again, where we bring the suspected COVID patients into the new tentage that we actually set up 1 year into the pandemic. Very tiring, of course, definitely. When you work on the ground with your staff, you're actually feeling very like physically drained. But when you come back to look into like workflows, changes, all these things, it actually makes you very like mentally drained because it squeezes a lot of your brain juice.
Undeniably, it's been a trying as well as a challenging period. We have had to attend to the patients who are stricken with the pandemic, but at the same time, we have to ensure that the other patients also receive optimal care. And we also had to adhere to strict isolation protocols to ensure the safety of our patients, our families, and as well as ourselves.
As KKH celebrates the 25th anniversary of Children's Emergency, we ask the staff what they hope for the future.
I was going to say, can I hope for the pandemic to be over?
I hope that in future, when we expand our facility, our plan will actually help us to cope with the next like infectious disease outbreak from the lessons that we have learned through this pandemic.
As the pediatric hospital, we hope to be and continue to be the first and the best providing the service that we can for the children.